So good morning, good afternoon, good evening for those of you connecting us. 6 a.m. in Colorado, Elaine. Okay. So good morning, good afternoon, good evening to all of you. Thank you so much for joining us in this new Maternal Health Supplies Caucus meeting. My name is Milka Dinev. I'm with the Reproductive Health Supplies Coalition Secretariat, and my colleague Laura Mayer and I, we support the Maternal Health Supplies Caucus. So with further ado, our chair, Dr. Metin Gulmesoglu, will be in charge of the meeting, will be chairing the meeting, and we will start with the presentation from Caitlin Williams from WHO. So go ahead, Metin. Good.
No, thank you, Milka. And I think I will keep it very short. I think our objective is to get an update on the PPH Summit follow-up and activities. I think, I don't know if others share the thought, but the general reflections, comments I hear are all positive, and people, I think, appreciated very much the meeting and the roadmap that was launched afterwards. So, Caitlin, maybe let's listen to you first, and then we'll open it up for conversations and questions and clarifications. Over to you.
Perfect. Thank you so much, Metin. And for those of you who I haven't met, my name is Caitlin Williams. I'm a technical consultant with the Maternal and Perinatal Health Unit, supporting Dr. Yanis Gallos on the postpartum hemorrhage work. And so my day-to-day is all things postpartum hemorrhage roadmaps. I'm very excited to be talking to you about this today because it is near and dear to my heart and what I think about all day, every day. So let me go ahead and see if I can share my screen here. All right.
We can see your slides.
Okay, fabulous. I'm going to try to minimize the meeting just because otherwise I think it blocks the screen. So feel free to interrupt at any point. I've prepared some brief comments about the roadmap, both introducing the roadmap because I think there are some of you who may be less familiar with the roadmap, and then providing some updates. And I should say that I'm not covering all of the updates on everything related to the roadmap, but I've tried to pick and choose some of the things that I think may be most of interest and most relevant for this group, given your focus. And I'm happy to go into more detail about any of the other pieces of the roadmap if that's of interest. But in the spirit of having me do less talking and Phyllis being driven more by your interests, I've tried to keep things somewhat limited here. So, as many of you know, the trends in maternal mortality reduction have been stagnating for the past few years, really since 2016, but we're quite off track for meeting the Sustainable Development Goal of no more than 70 maternal deaths per 100,000 live births. And with the current rate of progress, we will fall short of meeting this goal by more than 1 million lives. So recognizing the stagnating progress, earlier this year, the World Health Assembly adopted a pretty unprecedented resolution and trying to accelerate progress towards reducing maternal, newborn, and child mortality in order to achieve the Sustainable Development Goals targets 3.1 and 3.2. And at least with respect to maternal mortality, this is recognizing that there are 51 countries that are really tremendously off target for meeting their goals, and that are contributing the kind of have the burden of maternal mortality contributing to the global targets also being wildly off track. The largest contributor here is postpartum hemorrhage, right? Postpartum hemorrhage continues to be the leading cause of maternal death worldwide, and the burden is particularly heavy in the countries with the highest burden of maternal morbidity and mortality. And so in that spirit, trying to figure out what to do about postpartum hemorrhage, 136 stakeholders across a number of different stakeholder groups, so governments, ministries of health, professional associations, guideline developers, academic researchers, industry, implementing partners, including non-governmental organizations and civil society organizations, women's groups, and innovators all came together to say, what do we need to do as a maternal health community focused on postpartum hemorrhage to really turn the tide? What is needed between now and 2030 to put us back on track? And out of this meeting, this Postpartum Hemorrhage Summit, we developed a roadmap to combat postpartum hemorrhage between 2023 and 2030, or what we've been calling the PPH Roadmap for short. And this document is a blueprint for what we need to do as a global health community to try to get ourselves back on track for our targets. And this roadmap is now available in all 6 UN languages. So using that QR code that's on your screen, you can access the roadmap document, and that will also take you to the landing page for everything that WHO is doing on postpartum hemorrhage. So we know that it can be a bit tricky to find some of our resources sometimes, so we're trying to consolidate everything in one place and make sure that there's really a one-stop shop for you for everything related to postpartum hemorrhage, including the various translations of the roadmap. So I'm not going to get too into detail in the roadmap, and I'm not going to expect you to kind of work through this slide because I know it's quite busy, but what I'm trying to point out here with this slide is that the roadmap is organized around 4 main strategic areas. So the first being research, then norms and standards, so guidelines, the third being implementation, and the fourth being advocacy. And these strategic areas don't operate in independent silos. Right? They actually are quite interdependent. Things that happen in one strategic area feed into things that happen in another strategic area. And these interdependencies mean that this roadmap actually allows us to kind of move back and forth through these strategic areas so that they are synergistic and holistic and moving us towards our objective of accelerating progress on reducing morbidity and mortality related to postpartum hemorrhage, and really getting to this goal of ending preventable maternal mortality. And so a few of the items that I think might be most of interest to this group, I'll touch on kind of one highlight for each of these strategic areas. And there's much more here, and I'd encourage all of you to go and read the roadmap in detail if you haven't had a chance to do that yet. But these are a few of the highlights of what's happened so far. So in the last 9 months or so since the roadmap was launched, that I think will be of interest to this group. So first strategic areas around research. And some of you may be familiar with the concept of target product profiles, TPPs, right? Which briefly are documents that provide a kind of sketch or an outline of what the ideal product, whether it's a medicine or a device, would look like to help guide research and development, right? So target policy profiles conceptually are similar. These are documents that help to describe the ideal characteristics of research findings that could help inform policy, right? So to help transform policy. And in this case, we've been thinking about TPOPs specifically through the lens of, what kind of research evidence is needed to generate either a new or an updated WHO recommendation, right? And the idea being that this helps us move through the idea of an unmet public health need through really specifically kind of what is the type of research that would be needed, what kind of evidence would be impactful for WHO to think about reconvening its guideline development group and looking at that evidence again to see if a recommendation needs to be developed or if an existing recommendation needs to be updated. And so at the Postpartum Hemorrhage Summit and in the PPH Roadmap, there's a list of 15 top priority research questions, which are the things that the community felt really needed to be answered in order to move the field forward. And so we have been working on developing 15 TPOPs to go along with each of those 15 top priority research questions, which we'll be releasing in a dossier of these target policy profiles on postpartum hemorrhage later this year. And the idea is that these TPOPs really serve 2 different audiences, right? The first being researchers. So as a researcher, being able to look at a TPOP and say, okay, if I want to do research that could potentially help WHO to form its recommendations, this is the kind of research that might be useful, that might be worth pitching. And for funders who want to know that the that the research funding that they're providing is actually translating into real world impact. One way to do that is for that research funding to eventually produce impactful evidence that can inform a WHO recommendation. And so we wanted to give some guidance on how funding strategies might be shaped if they wanted to help drive that agenda forward. The idea is that, that as the research in these top priority research questions is conducted and advanced, that this will help to drive specific recommendations. And indeed, this has happened with one of the top priority research questions. But before I go there, Elaine, I saw you had your hand up, so maybe let me pause and
There's a hand up, Elaine.
Yeah. Thank you so much, Caitlin. This is really great. And sorry to interrupt. It's just a clarification question on the dossier for the TPPs. Did you say that that is coming out later this year or is out now?
Later this year. I know, eagerly anticipated, but it's working its way through our system. But hoping to get that out for all of you later this year.
Thanks.
Okay, so just to give you an example of kind of what this can look like end to end, right? I'd mentioned that there were 15 priority research questions and that one of these has already been answered. And I think many of you have heard of this is the emotive trial for early detection and first response treatment of postpartum hemorrhage. So that study came out in July in the New England Journal of Medicine, and the cost effectiveness analysis was released earlier this year. But this was an example of there being kind of really impactful evidence around an implementation strategy, right? So everything that's in emotive were already things that were interventions that were recommended by WHO. But what emotive did was bundle those recommendations together and say, if we do these, if we apply all of these interventions together in a really tight time-bound manner, rather than doing one and then waiting to see what happens and doing another and waiting to see what happens, right? We can actually get to really dramatic reductions in morbidity and mortality. And so this was an example of impactful evidence that WHO said, this would seem to warrant us reconvening the guideline development group and developing a new recommendation. And so based on this, the WHO recommendations on the assessment of postpartum blood loss and the use of a treatment bundle for postpartum hemorrhage were released towards the end of last year. So the study was published in July. I think these recommendations came out the very, very tail end of December. And so this is the type of accelerated timeline that we're looking to be able to use moving forward so that we're not having an instance where there's impactful evidence sitting on the shelf and not translating into WHO recommendations for some time, and that being an impediment to implementation in the field. So we're trying to really move our processes much faster in these iterative updates of living guidelines. We also are working on developing in parallel a comprehensive update of WHO's guidance around postpartum hemorrhage. So we know that right now the different recommendations live across many documents. We've heard that that's confusing for many stakeholders. And so we're in the process of consolidating those recommendations into a single guideline rather than, I think we have 8 separate documents floating around right now. But also making sure that we are addressing PPH holistically. So really thinking about the full natural history. So thinking about prevention and not just prevention starting from the 3rd stage of labor, right? But prevention going back into antenatal care. And what do we need to be doing to make sure that women are healthy coming into labor and delivery to help reduce postpartum hemorrhage? But then working all the way through post-PPH supportive care, right? So if a woman has a postpartum hemorrhage, what kind of supportive care are we offering after the event to make sure that she is healthier leaving the facility and also healthier going into any potential future next pregnancies? We also want to make sure that we're addressing things around health systems. So it's not just individual biomedical interventions, but really how do we strengthen health systems so that they're responsive and able to address PPH. So the executive steering group for this PPH consolidated guideline and the WHO technical advisory group for maternal and perinatal health guidelines met in November of last year. Coming out of that process, we have developed a memorandum of understanding with FIGO and ICM. And so this really is guidance that is coming jointly from these three guideline developers, FIGO, ICM, and WHO. And alongside providing executive oversight for developing the consolidated postpartum hemorrhage guideline, we're also working together to develop training materials for healthcare providers and are planning to work together to disseminate and facilitate country adoption and adaptation of the guidelines once they come out in Q1 of 2025. So Q1 of 2025 feels far away, but it is right around the corner. But we are planning to publish the consolidated set of guidelines for the prevention, diagnosis, and treatment of postpartum hemorrhage in Q1. And alongside that, training materials. We're working on a WHO Academy course so that there's an e-learning course available for continued education, and also developing a suite of implementation tools that will live together in an implementation toolkit that has a kind of implementation guide along with it, giving how-to instructions. And these are the full suite of materials that we are planning to launch next year. So work is frantically underway to produce all of these on a pretty accelerated timeline. I think many of you are familiar with how long it can often take to get these kinds of things into practice, but we're quite excited about all of the energy around the PPH roadmap and are trying to hold up our side of that and really get these materials out to all of you as soon as possible. A little bit on that. So that covers the research and the norms and standards strategic areas. The implementation strategic area is a very, very big one, and it's in the roadmap recognized as the place where there is perhaps most need for action, right? We sort of know how to do the research thing, we know how to do the guidelines thing. Implementation is often where we're getting really stuck, right? And so there are some improvements that we can make by tightening up research, by tightening up the guidelines, but really the bulk of the work is in implementation. And in the roadmap, you'll see that implementation covers a broad number of areas, but one that I want to really hone in on here for this group is around procurement and supply chain, because I think that many of you have much to offer us in figuring out how to get this procurement and supply chain piece really moving. So there are two kind of main things that we talk about in the roadmap under procurement and supply chain. So the first is around improving procurement practices for maternal health commodities, right? How do we better leverage existing initiatives? And the second piece is around national registration of quality assured commodities, right? We know there's been this tremendous work to get commodities through the WHO pre-qualification process, through various other stringent regulatory authorities, so that we know that there are good quality assured options for these different commodities. But we need to make sure that we're doing a better job of getting those all the way through the pathway so that they're available for the healthcare providers and the women who need them. And something that I know this group thinks about quite a lot. So I'll maybe pause my comments about that there. We spoke with a number of our partners recently and about some of the different initiatives that they have underway. And I wanted to pull out a few here that were specific to procurement and supply chain. I think many, if not all of you, are familiar with the various UNFPA supplies partnerships, the Match Fund, the New and Lesser Used Commodity Funds, and the HSS funding stream. Also the Amplify project, which is really trying to accelerate access to quality assured commodities and some of the other implementation pieces around postpartum hemorrhage. We also have Safe Birth Africa, MNH Big Bet, the GHSC BSM project, and these various other projects working in different countries with particularly high burden of PPH to make sure that we're getting good commodities, quality assured commodities to the people that need them. I'm happy to talk more about this later, but I'm going to keep moving it just in the interest of time. In terms of advocacy, one of the things that we heard loud and clear from stakeholders at the PPH Summit was that we needed to have a global PPH day. You know, there's global health days for lots of other different conditions, but it would be really helpful from an advocacy standpoint to have a global PPH day where we could rally the community, talk about the progress to date, and focus on what we need to do for the coming year. There's two different ways that we're exploring doing these. One is through a global health day through WHO, kind of a formal global health day in which a member state develops a formal proposal and that works through the official process at WHO. And this process is running in parallel with some member states kind of taking this track. And there was actually a piece, a I believe it was the Lancet recently calling for a global PPH day and really talking about why we need one. And I'm happy to share that link with this group afterwards if that's helpful. The other tack is for us to develop a grassroots PPH advocacy day, right? Recognizing that the WHO Global Health Day process can take some time because it is a quite formalized process. But if there's a desire for us as a community to begin commemorating a PPH day while that process is working its way through the system, that we can go ahead and do that, having PPH stakeholders decide on a day and start organizing PPH-related advocacy. And there is an advocacy working group that will be meeting later this month to start thinking about these different options and how we want to move advocacy efforts forward. So with that, just wanted to give a huge thank you to our many, many partners. WHO may have convened folks for the PPH summit and kind of steered the development of the PPH roadmap initially, but this is very much not a WHO roadmap. This is a collective PPH roadmap. This is a roadmap for all of us. So many of your organizations have already named your partnership with us, have been telling us about what you're doing to advance the PPH roadmap, and we're so grateful for all of your work. And if you don't see your organization's name up here, we would love to have you join our movement to combat PPH and to end preventable deaths due to PPH. And so would be happy to speak more with you about how your organization can get involved, how you and your organization can get involved. Last but not least, we have developed a postpartum hemorrhage accountability platform to help hold us all publicly accountable for the different milestones that are in the roadmap. So using that QR code that will take you to the roadmap, you can get a link to the accountability platform. I will say that it's a little out of date right now. The accountability platform was launched and we've been working on getting comprehensive updates from our partners, but we are preparing to update this accountability platform. So if you go into it now, it's going to look like we launched the roadmap and not much else, but we're working on updates to the accountability platform now. And hoping to be able to launch an update to this soon. So please keep an eye on this space. It's an opportunity for all of us to be able to talk about our progress and to really hold ourselves to account to the big plans that we made. It's not enough for us to put out a roadmap. We really need to action that roadmap. So I will also say, if your organization is working with us to advance pieces of the roadmap, the accountability platform is also a place that we can give your organization a shout out and talk about the work that you're doing. So again, this is a place for all of us as a community to be able to celebrate our achievements, not just for WHO to kind of talk about the things the WHO is up to. So with that, I'm going to pause and maybe let me stop sharing my screen so that I can see you all better, and happy to take any questions and comments at this time.
And we have a hand up from Ashish. Ashish?
Go ahead, Ashish.
Good
Able to
afternoon,
hear me now?
Ashish.
Hi.
Yes.
So I just have 2 or 3 quick questions, Caitlin. Is it possible that you can share the slides with the group? Okay.
I can do that. I'll make sure that we get those out to you all.
Okay. My second question is, since I am also a very significant player in the reproductive health space, I would also like to understand, like I saw some of my customers being in your slides, like MSF and UNFPA. So what is their role in this entire project? If you can just tell me so that I can also add value at the end of the spectrum as a manufacturer.
Yeah.
And my
Ashish,
last
you might
question.
want to introduce yourself, because
Sorry,
maybe not
sorry.
everybody knows that you're a manufacturer.
Yeah, I'm sorry. So I'm Ashish Das and I'm representing a Spanish company called as Senador Laboratories Private Limited. Milka might be knowing, but not many, but we earlier were referred to as in the name of Mylan Laboratories Limited. So Mylan has sold this female healthcare division to this Spanish group called as Insud Pharma, or also it is called in the name of Chemo Pharma. So now we are a part of this Spanish group and we do have manufacturing experience and marketing experience for more than 20 years in the field of pills, injections, patches, IUDs, hormonal IUDs, etc.
Thanks, Ashish. Lovely to meet you. And I'm familiar with Mylar, so I'm glad to know the story of the the new name so that I can locate you a little better. I think, gosh, it's going to be hard for me to quickly tell you what UNFPA and MSF are doing to support because there are so many pieces, and UNFPA in particular has a number of different initiatives that are related. So I'm happy to follow up with you one-on-one later if you want more detail.
Yeah, sure. That's okay. That's okay.
Yeah, but I would say, in broad strokes, I think the pieces that maybe are most relevant for you are around some of these different procurement initiatives, right? So things like the New and Lesser Used Commodities Fund, things like the Match Fund, that are ways for a select group of countries, I believe it's 54 countries that are eligible for the New and Lesser Used Commodities Fund, to be able to access specific products for the prevention and treatment of postpartum hemorrhage. And so they are working on kind of ensuring access for countries to be able to get those get quality assured versions of those commodities, because we know that sometimes access to commodities can be difficult, sometimes access to quality assured commodities can be difficult. So this is one way that UNFPA is trying to do some market shaping there and increase access to quality pharmaceuticals. There are some other things as well, and Ashish, I'll drop my email in the chat, and we can connect further.
Sure. Thanks, Caitlin.
Mhm.
And my last question, Caitlin, quickly is, in this entire exercise which you are doing so diligently, have you also already included the regulatory agencies in the emerging markets?
So the short answer is yes and no. Yes, in that I think that there has been some discussion. No, in that I think that there could be further work to more directly engage. And as we're working on trying to figure out the best strategy for lifting the various procurement related pieces of the PPH roadmap, I think there's an opportunity for us to do more there. I know that's a bit of a vague answer, but I don't want to get like too deep into the weeds. But I do think, send me an email and let's chat further one-on-one.
Okay, thank you. Thank you so much.
Thank you, Ashish. Tama, please go ahead.
Yeah, thank you. Thank you for great presentation, Kathleen. Really learned quite a deal there. My name is Tama Kalem. I'm the Senior Technical Advisor for GHSC PSM, Task Order for Maternal and Child Health, based in Washington, D.C., and we cover about 15 countries now for MNCH. I was quite thrilled to hear some of the progress already made since the roadmap was published. I was more curious about the accountability platform that you presented, and I heard there's more work coming there, so it makes me actually happy. My question is really related to all the work that we're doing. Would that be the primary platform where it's being presented, published, and accessible to the global community to potentially replicate some of that work? And you did also mention the supply chain aspect, which is, like you said, very important. Do I agree with you there? Um, would there be like a topical arrangement of those publication and publicizing of the work on that platform? I'm thinking more of, potentially creating different categories, for work, whether it's on supply chain, whether it's on advocacy, whether it's on financing and funding of various MNCH or mostly maternal health approaches. So that would be my question. And the second one, it's really related to some of the organization that you mentioned in your presentation, mostly regional, WOW, and others. So I was just wondering to what extent they've already been engaged on this work of supporting the implementation of the roadmap, because we do also work significantly with them, and we'll be happy to jump in and see if there are areas where we can also help to collaborate and push the envelope forward. Thank you.
No, thank you so much, Tema, and lovely to meet you as well. I think for the first question about the accountability platform, we are hoping that it's a place that we can start to house some of the work. So not just have it be check this milestone was done, but check this milestone was done, and here are some resources around it for people who want to learn more. I do think that being said, it's not necessarily intended as a knowledge management platform, you know. So I think there are a lot of efforts underway to try to create different knowledge management platforms, different repositories. Certainly RHSC has done a tremendous job of collating a lot of information in this space, and really is the first stop for many of us, I myself included, in trying to learn about what kind of work is happening in the procurement space, what are the lessons we can learn, what's worked well, what hasn't worked well. And I don't think we want to duplicate that, right? Like the RHSC website is so useful. We want that knowledge hub to continue to be that knowledge hub. What I do think that we may do with the accountability platform is to provide some links to be able to say to people who maybe are newer to the space, if you're interested in learning more about what's working, these are existing knowledge platforms, let's link you in, so that we're more networked, but not necessarily duplicating work that's already been done. I think the trick here is really for us to, us as WHO, to coordinate all of the different efforts that are happening, and make sure that, you know, each one of us kind of knows who else is working in this space, so that if we want to launch a new initiative, or we want to bring a project that's worked well in one context into another context, we can see who else is working in that space and find partnerships and collaborate, right? So that we can work synergistically together rather than all replicating without knowing that there's existing work happening. So I think the accountability platform is really designed as a way for us to keep up with the milestones in the roadmap and say, how are we doing and accomplishing the things that we set out to do, rather than being a place for us to kind of centrally share all of the information in the space that may be useful. But I do think we can use it to try to link people if it's a common platform that people are coming to for information about postpartum hemorrhage. In terms of your second question for engaging the different regional groups, I would love to take you up on getting some better connectivity into them. I think, you know, as we've been moving forward the different pieces of the roadmap that are in WHO's purview, much of that has really sat thus far in the research and guidelines space. And the implementation and advocacy space, we're starting to get moving as well, but there's more for us to do now that we've gotten kind of the research and the guidelines pieces a bit more advanced. So I think this is great timing for us to connect about how to better engage those regional partners. So please do send me an email. I've dropped my email address in the chat, and look forward to hearing from you.
Thank you, Caitlin. Jeff Jacobs.
Jeff. Yep. Hi, Jeff. I've received from others. Curious to know what comments you may have around how this roadmap has or has not galvanized, catalyzed additional funding from donors. As you know, one of the reasons why Merck for Mothers or MSD for Mothers was a co-funder of this initially was in talking to the donor space. Many of them said maternal health is just too fragmented, PPH is just too fragmented, we don't know where to invest. So if you could speak to that a little bit, that'd be helpful. Thanks.
Yes, I think we're starting to see a lot more movement from the donors, and a lot more conversations from donors around specific pieces of the PPH agenda. And things keep circling back to the different activities in the roadmap, right? So, you know, because different donors are in different places in their life cycles, it's hard for me to say to you, like, yes, there's, you know, X million that's been committed here, X million that's been committed there, just because everybody's kind of moving through their own grant cycles right now. But we are seeing that the donors continually are coming back to, well, was that in the PPH roadmap? You know, we've had a number of conversations with different donors, where there has been, oh, well, this idea came up, but it wasn't in the PPH roadmap. Is it something that you want to do, or should we really stay focused? You know, oh, we've been having some conversations with implementing partners, and we're encouraging people to come back to the roadmap in terms of thinking about their priorities as they work on their next round of funding. So I do think that kind of catalytic role that MSD for Mothers and the Gates Foundation had in trying to put this roadmap together and help to focus us and get past some of that fragmentation, we are certainly seeing that bear out, even if it may be a little bit early right now for us to be able to give you specific, dollar figures.
Maybe in the next webinar, you can tell us how much you got. Nikata Njeru, if you could introduce yourself as well, thank you.
Sure. Can you hear me? Just making sure. Good. My name is Nkatha Njero from the Africa Christian Health Associations platform. We are a regional organization working in about 30 countries in sub-Saharan Africa, representing the faith sector, working with Christian health associations. And we have in most of those countries about more than thousands of mission health facilities as part of our network. And thank you very much for sharing this with us, Caitlin, and very interesting for us. As you may be aware, the faith sector is mostly engaged at a level where we are doing implementation in health facilities and in communities. And this is really of importance to us. At that level of community and facility level, we are doing implementation, but at the secretariat level, our secretariat is in Nairobi, Kenya, but we get to work with the national secretariats in each of these countries. Research and advocacy have been areas that we are very interested in. And there's a lot of work in maternal and child health that is happening through the faith sector. And in many countries, there's a lot of support or collaboration with governments. But I'm just wondering, in your thinking at the level of WHO, what are some of the best ways you think that you would collaborate with the private sector and the faith-based sector to get this roadmap being as successful as we'd want it to be towards getting to where we want to get to? Any of your thoughts? How can we be of best use to this?
Katha, it's lovely to meet you, and thank you for such a wonderful question. Briefly, I think there are a couple of avenues, and I think it speaks to the fact that the way that faith-based organizations are operating in this space are kind of multi-pronged, right? I do think that there's a really important role in terms of care delivery, right? And as we're thinking about kind of service delivery, because of the large number of facilities that are being operated by faith-based organizations, for us to think about what are the best ways for us to work with all of you to make sure that your providers are also getting the continuing education support, that they're also getting the support for quality assurance of care provision, that you're also having access to the commodities that you need, right? I think traditionally, much of the thinking and much of the attention focuses on public systems and working with governments around public systems. And that's important. And at the same time, we also know that a tremendous amount of care is being provided by private sector organizations, right? So mission facilities, Christian Health Association facilities, as well as other private not-for-profit and private for-profit. So from the WHO perspective, we're really thinking comprehensively around the entire health system across all sectors and what is the kind of support that's needed across all sectors. And so as we're thinking about the guidelines, right, and the training materials and the implementation toolkit and everything that comes with the guidelines, we're trying to make sure that they're sector agnostic so that they'll be usable for you, even if you're working in sectors outside of government. But also as we're working with government partners to say, okay, the training strategy can't just focus on public hospitals. How do we really think about kind of the stewardship role and making sure that these other facilities are included in plans for training, for quality assurance, for quality improvement, for access to commodities as well. So I think we're counting on you as a really important partner in delivering quality services. And also to this other piece that you mentioned, the advocacy piece, right? There's tremendous advocacy work that faith-based organizations are well positioned to do that other organizations sometimes are not well positioned, either because of geography or because of reach or because of message or because of trust, right? And so I do think that there's an important advocacy role to play as well. And as the advocacy working group gets up and running and there's more clarity about the directions of that group, I should be able to give you a clearer answer. So I'm hoping that I can, send me an email as well so that we can be in touch as that advocacy working group gets moving, and I can give you a more specific answer about kind of what the advocacy agenda is looking like. I hope that's helpful.
Thank you, Caitlin. Suhas Monga, please.
Hi, Kathleen. Thank you so much for your wonderful presentation. My name is Suhas Monga. I work with Grand Challenges Canada, and we fund and technically support essentially innovations achieve their scale and sustainability, and that's the area that we work in. We have maternal newborn health as one of our biggest portfolio focus areas, where we intend to address 3 delays framework, and what are different emerging ideas that help in addressing 3 delays. So we have invested in a few organizations that support PPH progress. KMET is one of them, supporting the emotive bundle and bundling the supplies. So my question is more around, echoing what Jeff also mentioned, that what are some of the emerging sort of sub-focus areas within this entire PPH value chain that you would have come across in your research, and as you're thinking about, you've developed the roadmap. So yes, bundling is a wonderful implementation approach that's innovative. What could be some of the other emerging areas, like heat stable products is another potential areas. So, I mean, your thoughts on some of the emerging areas would be really helpful for us. Thank you.
Yeah, thanks, Suhas, and lovely to meet you as well. And also, great question. Thank you. I think, the elephant in the room is implementation, right? And we could have a beautiful guideline, but if that beautiful guideline sits on a shelf or sits on a website, it's of limited utility. So I think there's a lot of energy right now around, at least at WHO, around getting that guideline out, because it's a huge chunk of work for us, and one of our kind of core functions is producing that guidance for all of you. But I think that there is going to be a tremendous need for implementation support in the coming year, right? And saying, well, what does it mean to really put together holistic and sustainable plans for implementation? So that we're not funding individual implementation partners to do kind of small projects here or there in different geographies, but really thinking about kind of whole system strengthening, and making sure that we've got government systems that are able to steward the full set of recommendations being implemented across the full set of sectors. And so I think that could look a lot of different ways depending on the specific country context. But I think if I were to say generally, the area that I think is going to be most in need of support, and maybe most urgently under the scrutiny of the entire maternal health community, will be, how once we have all of these different pieces in place, right? We've got these resources, we have the guidelines, we have the training materials, we have the new and lesser used commodities fund. Like, how are we pulling all of those pieces together, and can we create some examples of kind of incubators where all of those pieces are working together in concert, right? So I think if there's the opportunity to work in a few countries that really are demonstrating leadership in this area, to say, okay, how do we support you to pull all of these different resources together so that you're using them really effectively, so that you actually can create something transformative in a short period of time. I think that would be really exciting and could give people a blueprint for what implementation rollout and scale up needs to look like from here on out. And if we can crack that code on PPH, right, there's probably a lot that we would learn about how to do that for other areas in health as well.
Right. No,
Thanks,
absolutely.
Caitlin. Maybe, sorry, just to maybe pick on Caitlin's message as well. So as we at Concept Foundation, together with Policy Cures Research, conducted a pipeline analysis of maternal health conditions, and we actually did a pipeline analysis for PPH medicines and devices, and we are working on target product profiles for PPH diagnostics as well. So this is all accessible on the internet, and as you can imagine, there isn't a huge number of new products because uterotonics are quite effective and safe. But I think, as you also alluded to, there are innovations looking at different delivery models of different medicines, including TXA intramuscular and other forms, and heat-stable uterotonics as well. So I'll also put the link on the chat so that you can access the pipeline. Sorry, you wanted to continue with another question to us?
No, thank you so much. Thank you for sharing your thoughts. And I completely agree. I think this is one of the areas that we have also been sort of brainstorming a bit about that. Yes, the innovations exist, and how do we make sure that people have access to those innovations? I think that's the biggest question that we are all sort of trying to answer. So thank you so much for sharing your thoughts.
Thank you. Caitlin, I have one or two small questions for you as well. I was waiting for hands not to appear. This PPH Advocacy Day, is it something that you are trying to implement while waiting for Global PPH Day to happen, or to happen in a formal, official way? And if yes, what are the sort of processes that you are going through? And also whether there's any scope for Maternal Health Supplies Caucus helping you with that as well, because there is a advocacy working group within the caucus as well, and I think you are probably in touch with them. The other question I had was these target policy profiles. Are you doing all 15 of them in parallel at the same time? And how does it sort of integrate into the postpartum hemorrhage guideline update and consolidation you mentioned in the beginning of your presentation, and whether it's a sort of separate process for future guidelines? Thank you.
Thanks, Metin. Let me take your two questions in that order, because they're kind of, the ease of ordering is also in that, ease of answering is also in that order. In terms of the advocacy day, so yes, I think we are trying to run these two processes in parallel for the formal day and the informal day, recognizing that the formal day needs to work through its process, and that process can be somewhat lengthy, and is out of our hands. WHO is available to provide technical support if there are specific requests that member states have around that, but that global health days are really something that are driven by member states. So we take our orders from member states and WHA on that. The advocacy working group, I will say that the Maternal Health Supplies Caucus of the RHSC is a founding member of this advocacy working group. So we will see that we're getting the two pieces to converge, and really under kind of Milka's leadership, we've been watching very excitedly about all of the work that that MHS has been doing, that the caucus has been doing, in that advocacy working group, and so we're really excited to follow Mel's leadership around that. So hopefully we'll have more to say about that later this month after that group has met and decided how they want to move forward. But stay tuned. In terms of your second question with the TPOPs, the target policy profiles, so yes, we are developing those in parallel with working on the guideline. And as you've suggested, there is some convergence between the top priority research questions that came up at the summit and are in the roadmap, and then the questions that we're looking at in the guideline. And so to the extent that we're able to get some of those to converge, the guideline development group will be looking at evidence related to those questions. I think there are places where there was a research question that maybe was posed as a top priority research question by the PPH community. And as WHO has started looking at that evidence, starting to put together, as we've been working through the target policy profile, we've said, gosh, there's an awful lot of evidence here. Actually, what we may need is, rather than new studies, is a synthesis of the evidence that we do have to have a clearer understanding of what pieces of this question have we answered and what pieces are still pending. so that we can give more guidance around where specific research is needed. And to the extent that the evidence synthesis gives us enough information for a guideline development group to potentially action something, we want to put that in front of the guideline development group. So these pieces are running in process. We're trying to keep them running neatly enough in parallel that things come out at times that make sense. So we're not telling you all, oh, this is the research agenda that you should do. And then 2 months later, guidelines come out with recommendations that address those things. So this is, I think, a bit of the task of coordinating the roadmap is trying to make sure that all of these different pieces are moving together in concert, and that the pieces that get published are published in ways that make sense to all of you, so that we're not giving conflicting information, because I think that speaks to the fragmentation that we've traditionally had in this space, right? Is that kind of funding will come out for research to go in one direction, and then WHO says something, and there's not, or a different guideline developer will say something, and so there's not clarity on whether the research is needed or how it advances things. So we're trying to do our best to coordinate all of the outputs that we have control over to try to make sure that things are coming forward in a way that doesn't increase the fragmentation. Hope that's helpful.
No, thank you. Very helpful. Thank you, Caitlin. Milka, you put something on the Catalytic Opportunity Fund. Maybe you can just talk us through that.
Right. I was trying to let people ask all the questions, but I wanted, this is a preview. We will do an official announcement, but we have already awarded 3 grants in Kenya, in Sierra Leone, and in Uganda to scale up and disseminate the use of heat-stable carbetocin for the prevention of PPH and tranexamic acid, TXA, for treatment. So this is probably one of these first implementation activities that we all want to see. We have in the pipeline 3 or 4 more of these grants that are ready. They're in contracting. We're still negotiating with the grantees. So I think that this is going to inform a lot the roadmap, and it will also give us an opening to disseminate the roadmap in all these countries. So yeah, we're very excited about this.
Congratulations, and congratulations to all these Sierra Leone, Uganda, and what was the third country?
Kenya.
Kenya.
The first International Center for Reproductive Health is in Kenya, Rwenzori in Uganda. I don't know if Jostas is here, but he usually comes to our meetings. And Mama Pinkin is in Sierra Leone.
Thank you. Any other questions for Caitlin or any updates from anyone? We still have a few minutes.
Yeah, Metin, just quick, Caitlin, any thoughts about doing something like this for other conditions? Roadmap?
Yes. My understanding is that there are plans in the works for additional conditions. I'm not sure what information is ready to be publicly unveiled yet. So that's all I'll say for now. But yes, stay tuned.
Thanks, Caitlin. Keval Bakchivani? Keval, you have a question?
Yes. Hi, everyone. My name is Keval, and I'm a representative for Tasa Pharma, who are a manufacturing company based in Kenya. It's more of an update, so I just wanted to firstly thank Caitlin for the presentation and the work she's doing. So Tasa Pharma manufactures injectables and is a relatively new company. It's only been around for a few years, and one of our products is tranexamic acid, which is obviously of great importance and interest for PPH. And we've recently been identified as the only manufacturer of tranexamic acid on the continent, which we didn't know. So we're currently actively pursuing our WHO pre-qualification, which is well underway now. We've had mock inspections, and we're working with the USP and USAID as well, who are providing support. The mock inspection went very well, and the dossier is ready for submission. So we're hoping to achieve WHO pre-qualification very soon, and sort of expand the supply from beyond Kenya to the surrounding regions where this is also a massive issue. So yeah, I think this is a really exciting work, and it's great to be involved with a group of people who are sharing a similar goal. Thank you.
Great. Congratulations. Thank you. Thanks for that intervention.
Yeah, thank you.
Milka, any?
Keval, what is the name of the company you said, Keval, you are representing?
It's Tasa Pharma, TASA Pharma.
Tasa Pharma.
Yeah, based in Nairobi.
And you are doing local manufacturing for TXA?
Yes, correct.
Okay, that's great, Keval.
Thanks.
And you can find the information in the report we did on maternal health products being manufactured in Africa. There, I'll maybe Laura can help me put the link in chat. It's a report that we did in partnership with US Pharmacopoeia, and it provides the landscaping of maternal health products manufacturing in Africa. So you might want to check that. Thank you.
Thank you, everyone. Thank you all. And Caitlin, thank you very much for the update. And as you have seen, lots of interest and lots of questions coming up. So maybe we'll come back to you and WHO colleagues in coming months again. Milka, do you have any closing remarks, any housekeeping issues to report?
Yes, well, this was our normal Maternal Health Caucus meeting. So I was just wanting, we have what, 3 minutes left. So maybe if somebody has any announcement, we could accept maybe 2-3 interventions, announcements, webinars coming up, projects that are launching. Please do come forward. Anybody has any announcement?
Metin, you want to make mention of the supplement that's coming out? Might be useful.
Yes. I think Sarah is also in the call. Maybe Sarah can get and give more granular information. Sarah, are you still there? So maybe Sarah dropped off. So
yeah, she's not there. No.
So we have as you may have been aware, we conducted a 5-country introduction implementation research project of introducing heat-stable carbetocin and tranexamic acid in Ghana, Sierra Leone, Uganda, Burkina Faso, and Ethiopia. And we did this in both tertiary and primary care facilities. So together with the report of those 5 countries, we also compiled a number of implementation pilots conducted by colleagues in Nigeria and Kenya by Smiles for Mothers, and another team in India, and UNFPA humanitarian team who did a similar study in South Sudan and Uganda. So all of those studies are compiled in a supplement in a journal called International Journal of Maternal and Child Health and HIV. And they are going to be published on the web, free access or open access in the next 2 weeks or so. So we will communicate the actual publication date to everyone when we have the exact date. We don't have the exact date yet, but it will be coming out in the next 2 to 3 weeks.
And Metin, the focus of the study is what? Feasibility, acceptability, and appropriate use, correct?
Yeah, that's correct. Yeah.
And Sarah and I are working on organizing a webinar for the first week of October on those results. So you will have more detailed information in that webinar. Anybody else? Any meetings coming up? Any publications coming up? Okay, so we are on the top of the hour. Again, Caitlin, our most sincere thanks. We're very grateful for your time today. We know you're traveling, and I know this has been an extra effort. So thank you so much, and we'll be in touch. The advocacy working group is going to be meeting soon, so we might be able to have more news for the caucus in the near future. So thank you very much. Have a good afternoon, a good start of the day for those of us on the other side of the world. So thanks again, and we'll see you soon, hopefully in our next webinar. Bye-bye. Thank you.
Thanks, Caitlin. Bye-bye.
Thank you, Metin.
Thank you, everyone. Bye.
Bye-bye.
Thank you so much.